So it is the 1st of November, 2019. I'm here with Michael O'Donnell in, is it Boulder? Where in Colorado?
Well, actually, I live in a little town south of Denver called Littleton.
Oh, okay.
Yeah.
I'm here in Novato, California. And we're going to find out who you are and why, in particular, as it relates to my growing project of oral history of wellness.
Uh-huh.
And our careers kind of run in parallel. We
A little
didn't
bit.
have a whole lot of contact, but I'd sure hear your name a lot.
Yep. And I remember we actually met at a national wellness conference
Yes.
probably about 20 years ago.
Yeah.
Yeah.
Well, you got a better memory than me. So are you a Michigander by origin?
I lived in Michigan for 20 years. I went to grad school at University of Michigan, and I worked at Beaumont Hospital in Michigan. But I've lived overseas. My dad was in the Peace Corps and was born in Indiana. And I also lived in Ohio. And now we've been in Colorado for about 3 years now.
Well, I'm from northwestern Ohio, Bluffton. Did we
Sure.
get that close?
Yep.
Grew up listening to CKLW. And
I was at the Cleveland Clinic for several years.
Oh, okay.
Right in Cleveland.
Well, so what got you interested in health promotion? Like what was your background originally?
Well, in college, I was a psychobiology major, and I had this idea that we might be able to solve physical problems. We might be able to help people heal through emotional and cognitive strategies. And that was back in the the early 70s. And, that field still hasn't gotten there yet, but I was really intrigued by that. And not so much as a clinical psychologist, but really more, how can we build our health systems to incorporate those concepts? So I went actually from Oberlin College to California because I thought, if this is going to happen, it's going to happen in California. And I went to UC Berkeley to study healthcare management. And my idea was to learn how hospitals work, to see how we can build these ideas into the healthcare. And I stuck around and also got my MBA because I discovered this emerging field of workplace health promotion. And so that's really how I got started.
And it was at Oberlin because I was at Worcester.
Oh, interesting. Yep. Those are very close. Yep. Oberlin.
Yeah. We often connected with you guys. So, well, now, any earlier predilections towards health, like as a young man or boy?
I actually, in 1974, I became a vegetarian and have been a vegetarian ever since that time. And I worked out all the time. So I knew that when I was physically active and I ate well, I felt great. And that's really what got me going in terms of workplace health promotion. I had this idea, and this was around 1978. I said, it probably makes sense if companies keep their employees healthy, they're going to be more productive and they're going to have maybe lower healthcare costs. And the field really wasn't defined very well at the time. And that actually made me really start looking at, what was out there. And this was really an emerging field. It was really concentrated around fitness. And for some reason, I decided I better write a book about this. There wasn't really a reference text on the field. So I was an MBA grad, and I knew how to write a marketing plan. So I pitched a book deal to a publisher, and they said yes. So for 5 years, I worked on a book called Health Promotion in the Workplace, which was a collaborative effort among really experts in all aspects of that area. And it finally came out in late 1983. And the field of workplace health promotion was really just coming together. So that's really what got me started at a professional level.
Yeah, right there in the foundation of it.
Yeah.
Well, fascinating.
I was also close to the Silicon Valley, which is where these companies were starting.
That early?
Pardon, we're, just north of the Silicon Valley in Berkeley.
Yeah.
And you had this
Okay, Berkeley.
phenomenon where these tech companies were starting and they couldn't hire engineers fast enough. So they had to come up with something, how can we can't keep raising salaries? What can we offer them? So they built a fitness center with a sand volleyball court. And so they were really very open to listening to this idea of, they weren't really thinking about people getting sick because their people were 20,
Right.
30. But they really liked the idea of recreation, for these young engineers who they couldn't attract fast enough.
Keep them happy. Yeah.
Exactly, yeah. And keep them at work as long as possible.
Well, you probably didn't encounter the problems that we did where we had to spell wellness in the 70s, that no one knew what it was because health promotion is pretty self-evident. But did you get much pushback from any of the powers that be? And
Yeah, absolutely. When I was trying to come up with a name for my book and then later for my journal, the reason I chose health promotion is because that's what the Office of Disease Prevention and Health Promotion, which Larry Green was the head of at the time, that's the term they used. But I found that when I went out and talked to people about it, they had no clue what we're talking about. And I actually discovered the same is true today. All these years, all these decades later, they'd say, oh, do you do like brochures for doctors' offices? So it's one of these terms that, most people, unless you're in the field, you know what it is, but outside the field, they really don't know.
Interesting. And did you have much connection with Larry Green in those days?
Larry Green has been a friend for a long time. He was actually, when I started the American Journal of Health Promotion, which came out in 1986, he was one of the first editors that I recruited. And, like everybody, Larry is the guy we all looked up to. He was probably still the most prolific author, scholar in the field, and such a great mentor to so many people.
Yeah, well, he turned up. When I was doing my master's in public health and my residency in preventive medicine at Hopkins, I was assigned Stebbins, who was semi-senile. He was, the old master, but useless as an advisor. And I stumbled on Larry Green, who had apparently just arrived. It was after a year of being there, and I glommed onto him, and we became fast friends. And I see him occasionally. He was one of the first people I interviewed 2 years ago for this project. So yeah, another completion of this circle.
Well, Larry is somebody, I just was so appreciative of everything he did to help me launch the journal and other projects. And I thought, this was an unusual thing that he did for me, but I've spoken to so many people who've said he helped them in similar ways. So, that's one of the wonderful things about our field. There's so many wonderful people. They want to take care of themselves and they want to help others and they want the field to grow. So we're just so lucky, John, to spend all of our time with those kind of people.
Yeah, and most of us are still alive, which is what I'm trying to collect before too late.
Right. I'm really happy you're doing this to record these histories, especially the people who are getting up there in age.
Yeah, well, Norm Shealy's pushing 90, but he's still going strong. And several of the people that I did get recorded have since died, but that made me more motivated to get out there and collect them while I could. So did you get any direct flack? I get that people didn't know what you're talking about, but did you get flack from people of, oh, you shouldn't be doing this? Or
I didn't really get any flack. I worked my first job actually during my administrative residency during grad school was at Kaiser Permanente in Oakland, and that's where it's based. And Kaiser for so long has really focused on population health. And so they were very open to the concept, but still not really invested. It's a hospital and, they're educated in treating disease. So the focus was really medicine. And that's what made me decide to go out and start talking to employers. And they really loved the idea. And, the people I spoke to, included the technology companies in Silicon Valley, but also companies like Bank of America, very traditional numbers driven companies. And it really made sense to them. So I didn't, go ahead.
I didn't realize you had the connection with the Oakland Kaiser because my advisor at original advisor at Hopkins, chair of the department, I was in operations research, Charlie Flagel, had a desk in the office at Kaiser that they shared with Sidney Garfield. And I was out there for a week.
One of the original founders of Kaiser.
Yeah.
Yeah.
But I was to run our multiphasic health screening center in Baltimore at the Public Health Service Hospital. And they wanted me to spend a week with Maury Collin. And his wife actually had a health education center set up across the way from their multiphasic. Now, that may have collapsed by the time you were there because they eventually found out multiphasic wasn't cost effective. But they were focusing on that and her health education, which was radical. I went in, they had a whole library. Was that still going when you were there?
I don't know. I was actually at the hospital level. So I reported to the administrator of one hospital. And I can't say that I really looked into all the parts of Kaiser. And I don't want to be critical at all of their lack of interest in this area. But it was really more, I wanted to get out into the corporate world where I thought they were going to be really ready for this idea. As it turned out, I did lots of concept selling. I knew most of the HR leaders of the big companies in the entire Bay Area. But I was just a guy, young, recent grad on my own, and I didn't really have the credibility to do this thing that they didn't even know what it was. So I ended up joining San Jose Hospital and launched a program for their employees. And then also, that was my base for reaching out to the Silicon Valley employers.
Oh, okay. And what years were you actually at Kaiser?
I was at Kaiser during my grad school years, which were 76 to 79. And I was at Kaiser, I believe, like toward the end of that time. I don't remember exactly I was there for just 9 months as my administrative residency.
Yeah. I'm wondering whether that health education project had folded by then. That would have been 6-7 years later. And it'd be interesting to go back and see what that history is. Yeah. I'm sure Maury Collins isn't still alive, but there was another guy, I'm trying to think of his name, that was active in it then. And I've seen his name around, but they tried it. But what I noticed was that it wasn't where the patients were. Yeah. And that's where you need to have a teachable moment. So,
I don't know when that program ended, but they've really continued to be very interested in this area, and they have integrated these concepts into patient care. They've done it with their employees, and they also do it in their community outreach area. So they're really invested in it now. It's just I just didn't happen to be at the right place at the right time in that organization, and I wanted to get out into the corporate market as well.
So are you still full-time, or are you slowing down any, or what's
I'm I recently sold the American Journal of Health Promotion. Actually, in 2016, after 30 years. And then I was on the faculty at University of Michigan until 2016 also. But we moved out here to Denver to be close to my wife's family. And so I still work full time, but nobody pays me. I call it semi-retired, and my wife says, no, you're not retired at all. But I'm working on something that's really fascinating now. It's called Ecosystems for Healthy Lifestyles. And the idea is typically when we try to help people improve their lifestyle to address health problems, what we do is too superficial. And it's often cognitively focused. And so our idea is to create ecosystems where people live and work and heal and play and pray, and to make this something that's all over Colorado. So our goal is really to make healthy lifestyle the norm in Colorado. And we've been working on this concept for several years, and we've finally come together in a legal structure, and we're working toward a pilot, which would try to do this, for example, in all the hospitals in the greater Denver area. So it keeps me busy, and it's a lot of fun.
I need to take a break here. I'm getting an emergency phone call from
Okay.
I'm going to pause the recording.
Okay. I'll be here.
And back again. What do you think the future is? Is the magazine going as you would like? Often when you sell something, it doesn't.
It's going very well. They chose Paul Terry as the new editor-in-chief, and he's really doing an outstanding job. You know, his
Great.
background is really in education and organization development, and he was with Staywell for a long time, and he's now he was the CEO of Hero. Now he's, I think his title is Senior Fellow. So he has great perspective, and he's a great person to run a team. So I'm very pleased with the way that's going.
Wonderful.
Yeah.
And what do you see as the future for you and for the field?
Well, this for me right now, I'm focusing on launching this effort, Ecosystems for Healthy Lifestyles.
Mm-hmm.
And I think it's where we need to go for a couple reasons. You know, there's been a big move towards social determinants of health, and in terms of providing housing and transportation and food and income, good jobs for people. And those, you know, I see those as kind of prerequisites, but insufficient. And my concern is, and I see a lot of foundations focusing in this area and, you know, public health scholars, but the reality is that people like you and me, people who have what we have, people who have all the resources in the world, still the majority of them don't practice healthy lifestyle. So, you know, we definitely have to address the social determinants of health, but then we have to also help people improve their lifestyle. And, you know, when it's much more difficult for someone who doesn't have those resources to practice healthy lifestyle. But if you don't practice healthy lifestyle, it's going to kill you, whether you're rich or poor. So it's going to take, I don't know, what I hope the field starts doing is looking at, you know, what's the best meshing of those two concepts. And, you know, I talk a lot about having a therapeutic dose, and which is basically, you know, whether it's a medication that your doctor, you have an infection, you know, take this many pills this many times a day for this number of days, or your infection's not going to go away. The same thing is true for most of the lifestyle areas. You know, we know, for example, for smoking cessation, the optimal time for counseling is 300 minutes in 8 sessions. And we have huge meta-analyses that tell us that. And we know the quit rate by type of medication, and we know how to meld those two. And we can almost predict if you do less than that, here's the success rate that you're going to get. If you do all those things, you'll get like a 35% quit rate. And if you do less, you'll get below 35. And one of the big problems in our field is we've been delivering superficial programs for too short a time, mm-hmm. and not focusing on the most relevant intervention. You know, should it be a cognitive intervention? Should it be a physical intervention? Should it be an environmental intervention? So my hope is that we take the best of what we know on lifestyle change and build them into the social determinants of health model. And that's really what we're trying to do with Ecosystems for Healthy Lifestyles.
Great.
Yeah.
Well, more power to you.
Thank you. Thank you. Yeah. By the way, another fun thing I'm starting to do is swim vacations.
And how?
So, for example, next summer, I'm going to go to Greece with this group called Swim Trek, and you spend the morning swimming, like from little island to little island, or around the islands, looking in caves and things like that. And, you know, you get sort of crazy people like me who love swimming, and then you have your afternoon off, you know, to wander throughout, you know, the Greek Isles. And I want to do one of those in the Galapagos a year later. So that's another new thing that I've introduced into my life.
I've never heard of them.
I know.
You have to have webbed fingers to...
Well, you know, you just have to be able to swim. You don't have to be a world-class swimmer. You know, you have to be able to swim like 4 to 5 kilometers a day, you know, broken into 2 swims, which is very doable for, mm-hmm. you know, I work out, I do about 4,000 yards a day in my workouts. So it's sort of like doing my regular workout, but in the ocean in Greece or Galapagos.
Yeah.
Yeah.
Well, I live near the Coral Sea half the year, which is warm most of the year. I'm not there in the winter, but
Uh-huh.
nothing like good salt water to.
Yeah, help you float more.
So I'm curious. I would hear a lot about health promotion back in the days when I was doing adult wellness. I switched into infant wellness in the
Yeah.
mid
Yeah.
90s and pretty much left most of the adult wellness to Jim Strohecker's work with the wellness inventory. And
Hmm.
he got far more acceptance of that than I ever expected. Even the Army is flirting with using it, aspects of the Army.
Yeah.
But we debated on using the word wellness. When I read Dunn's book, I loved the mental, emotional, and spiritual components.
Right.
But I thought wellness was a stupid word and it would never catch on.
Yeah.
And reluctantly used it. Dan Rather opens his piece saying, wellness, there's a word you don't hear every day. But then it did catch on, but it got terribly diluted, where dog food would be the #1 Google hit.
Is that right? Yeah.
Yeah, Don Ardell just found that's changed recently. It's now the #7 ranking, but there's a wellness pet food company that was getting all the hits.
Yeah.
So, but
well, my experience with that, I had my book, Health Promotion in the Workplace. I had American Journal of Health Promotion, my conference, The Art and Science of Health Promotion. So health promotion was really my phrase. But when I went to work for the Cleveland Clinic, which is an academic health center, #1 heart center in the nation, I went there to set up their employee wellness program. That's what they use. They use the term wellness. So at a very serious medical center, that's the term that they used. And that's the term that resonated with the employees. So that's the word that we stuck with. And that's really what I have found to be the best strategy. The word or the concept that makes sense to the people there, that's what you go with. And then you help them, you describe what you want to achieve, and they associate it with that term. But I was the same way. I thought wellness sounded flaky, and I never used it until I went to the Cleveland Clinic, ironically.
Interesting. I didn't know that.
Yeah.
Yeah, well, I almost dropped it back in the late 80s when it had become so cheapened, but I had a book out with wellness in the title that made it a little hard to do that.
Yeah.
And well-being is catching on now.
Right. Yeah.
Yeah, it's the battle to try to get Dunn's ideas. Did you ever read Dunn?
I did, many years ago. And, both his work and, Bill Hetler's work at Stevens Point really influenced my early views on this field.
Yeah, when I went back and read Dunn, I was astounded at how far behind we were and what he was thinking of in the 50s, that we're still not there.
Well, when I started American Journal of Health Promotion in 1986, we defined optimal health very similar to national wellness, a balance of physical, emotional, social, spiritual, and intellectual health.
Mm-hmm.
And my vision was that over time, we had focused well already on the physical health. And I hoped that we'd expand as a field in workplace programs into all those areas. And the emotional certainly has caught on. The social, I think the people have recognized the critical importance of the social element in terms of engaging people and maintaining healthy behaviors. The spiritual is kind of scary for most workplaces. They don't impose values, except I found in, for example, Catholic hospitals, that they can definitely gravitate toward that. And the intellectual, it's, of course, you have to improve your mind and your ability to perform in a work setting, but I haven't seen that incorporated into the typical wellness programs. But the whole idea of a holistic view, that's really one of the things that's been embraced by people advocating the well-being term. But interestingly, many of those people don't know about this early work that had been done conceptually in that area. So I find that again and again, that people moving into the field are discovering this field and thinking that they kind of invented it. They also, one of the nice things about these interviews you're doing, they don't know a lot of the people like us who've been working in this field for decades. And
Yeah.
that's okay. It was more surprising than disappointing to me.
Yeah, well, it'll be interesting to see if anyone actually cares about the early history and dredges up any of this stuff. But I thought it'd be good to have it stored anyway. Norm Shealy had very encouraging many years ago, but didn't know what to do with it. Now with the YouTube, I can just put them all there and see what happens. So, well, besides swimming, what do you do for fun? And
Well, I love to hike. This is a great place in Colorado is to hike. And we also love to hike in Ireland.
Oh.
My extended family is from Ireland, and we have a cottage there, and some of the best hiking in the world.
Wow.
Yeah.
Are you a skier?
My family is, my wife's family especially, and I kind of go along reluctantly. I don't really embrace it, which is kind of funny for someone in Colorado to say. Like when's the slope opening? And we're already open here in Colorado. Yeah.
Well, any other thoughts on the past, present, or future of this area?
Well, this is actually related to why I started this ecosystems project. When I came here, I discovered that the governor of Colorado, John Hickenlooper, had said his goal was to be the healthiest state in the nation. And I really thought that was fascinating. And I wanted to find out, how are they going to do this? And I met all the people involved and read all the documents. And after a couple of months, I thought, there's actually no chance of being successful. And they said, why? And I said, well, it's totally under-resourced. It's under-resourced in terms of money and in terms of intellectual know-how and social capital and policy. So I thought, how can we shift that? And so my next pursuit was, I came up with the number $250 per person per year, which is $1.4 billion for Colorado and $80 billion for the United States. And to me, that sounds like a lot of money. That's more money than I make in most months. You too? But it's about a third of what employers spend on medical care for their employees. Mm-hmm. And it's 0.3% of what employers actually have in liquid assets in the bank. And it's about 1/3 of the gross domestic product of Colorado. So I thought, instead of thinking about this as an extra cost, we have to build it into the economy. So it's, for example, whenever we spend money on agriculture or transportation or building cities, we've got to build this in. Mm-hmm. And then it just becomes an add-on. It's like I discovered this early when I was working in workplace programs. And I was advocating fitness centers. And, if you want to build a fitness center, it might cost $200 a square foot. And that's an extra cost when you're building the fitness center. But when you build the whole building, like for a new campus, it's the person building it doesn't even notice the cost. It's just like the same as the cost of any other square foot. And so if you can just build what we're doing into the flow of money, that's how we're going to get where we need to go. And that's really what we're trying to do with our ecosystems project. So it's a different way of thinking, make this not as an extra cost, but as part of the normal flow of money.
Yeah, and you can look at the hidden costs of not doing it.
Oh, yeah. I mean, it's like even separate from the potential cost savings, just build it into what you're spending already. For example, that's what the Cleveland Clinic did. So at the Cleveland Clinic, the costs for the employee wellness program were built into the health plan costs. Mm-hmm. And for about 5 years, there was no change in the cost, even though the employee wellness program was several $1 million a year. And then by the sixth year or so, the cost trends started to change. And the savings have been remarkable. I'm not going to tell you what they are here because the papers are just coming out and it's not my information to share. But it was just part of the health plan cost. And the the programs that were offered were highly intensive. You know, they could cost thousands of dollars for some employees. They didn't have to, but it was just part of the cost of the health plan. And the clinic was self-insured. It was the employer, the provider of care, and also the insurer. And the savings were strong. They're very strong. You know, they're in the hundreds of millions of dollars over the decade. And for the employer and for the employees, in terms of lower costs, they're in the tens of millions of dollars. So, but it was a matter of just building it in to the flow of care. And then the cool thing is that the medical staff, by engaging with the employees on these programs, started to embrace these concepts into their care with their patients outside the clinic. Wonderful. So it was really a culture change. And that's another thing, you know, our pilot in Denver, our goal is to start with all the hospitals in the greater Denver area and to focus on great programs for the employees' health, but also integrating these concepts into patient care and also integrating them into the community outreach programs. And so there's a wonderful ripple effect.
Wow.
And our thinking is it's not going to increase costs. We're not going to overpromise the cost savings, but do this without increasing overall costs, but improve employee health and productivity and patient outcomes as well.
So is the Cleveland Clinic Wellness Program still under that name and going strong?
It's under, I think it's called Cleveland Clinic Employee Wellness, and it's doing very well. And it's really become part of the culture.
That's great.
Yeah.
Another interesting connection is I didn't realize Colorado was had that intention. And back in I think it was the early 80s, could have been the late 70s, a fellow in the governor's office, it was Dick Lamb was the governor then.
Yeah.
And he was pitching wellness to Lamb. And he brought a bunch of us into Lamb's office to do our dog and pony show.
Mm-hmm.
And after I did my slideshow, Dick said, "I'm convinced, Floyd. What do you want me to do?" And we'd only given him half the show. But Floyd said, "I'll get back to you." He hadn't expected it to be an easy sell, but it didn't go that far, I guess, because they're still interested in leading the pack. So,
well, you know, the governor, Hickenlooper, is no longer governor.
Right.
The current governor is Polis, and he's very open to these ideas, but his bigger initial priority is really providing good medical coverage to the entire population. But also, you know, government, like state level governments, they are employers. They're also the funders of things like Medicaid, you know, which actually consumes 29% of the Colorado budget, and that's comparable to other states.
Mm-hmm.
So they're great conveners, and they also, you know, the bigger government with legislature, they have policies, and but they don't know how to do this, you know. So I mean, they're big employers who have to take care of their own employees. They're usually the biggest in any state, the state government is. And then they spend a lot on Medicaid, and then they influence policy. And if we think of them in those three different areas, we're going to be more successful, as opposed to saying, you need to do this. Because, you know, just like in your experience, you know, they brought in these experts to ask, how do you do it? Because they had no clue. Mm-hmm. And so, you know, our hope is to influence other states to do this. You know, it's definitely a boil the ocean kind of dream, but it's fun.
Great. Well, how to have a dream.
Right.
Well, I'm about out of questions. I feel like we've really covered a lot of waterfront. And
well, I'd like to thank you for all the contributions that you've made over so many decades. And it's, you know, just in terms of helping us think about these important ideas. And I was interested to see that you actually went back to Hopkins after you were a physician who'd been practicing. And you know, I really respect that you took time out of your career to go back and explore this new idea. And you certainly inspired many people. And I know you've been a very good friend to many people. So I just want to thank you for doing everything you've done for our field and for
Well,
trying to, making this effort to record this history.
well, thank you. Well, just to correct the record, though, I didn't actually go out and practice. I went to Hopkins directly out of my internship.
Really?
Yeah, because
Okay.
I discovered as an intern, I couldn't write prescriptions for drugs. I just couldn't do it. I couldn't remember the dose. I couldn't remember the names. It just felt like I was drugging a problem that was more basic.
Interesting.
And I didn't know what I wanted to do. My dad was a country practitioner, surgeon, ophthalmologist, obstetrician. He did everything. And I grew up with that, but that wasn't the medicine I was trained in.
Yeah.
So preventive medicine seemed like the way to go. And I was offered this position with the Public Health Service running a multiphasic screening clinic with computers, which was my love. I almost went into engineering. And so that was the attraction. But it was the Hopkins Medical Bookstore where I stumbled on Dunn's book on the clearance table.
Interesting.
Probably in spring of 71. I used to go there to get inspired because the Masters in Public Health curriculum was so boring. I just, sanitation and epidemiology and statistics and
Right.
child health, that wasn't grabbing me. It wasn't really prevention, it was early detection.
Yeah. Yeah.
So Dunn's book was, well, first of all, it was in back in Sidney Garfield's office. On the bookshelf was How to Practice Prospective Medicine by Louis Robbins,
Yep.
which boggled my mind and got me interested in HRA, which I then programmed for the Public Health Service Hospital.
Mm-hmm.
But then we saw that didn't really change behavior. It scared people, but it didn't change behavior, which led to the wellness inventory. So it was during my residency that I really cooked up the idea of wellness, and it was more. I stumbled on it.
Yeah. Isn't that
Any
interesting?
conscious path.
Yeah. Well, it is interesting because, like, I know what you're talking about. When I was in getting my MBA, I needed a summer job, and the dean of the school introduced me to two grads, not recent grads, but two MBA grads who were about 10 or 15 years ahead of me, and they were trying to set up a fitness center in the Embarcadero, which is downtown San Francisco, and right in the middle of the financial district. So I worked for them for the summer, and then they said they discovered the National Wellness Conference, which they sent me to, and that's how I discovered this workplace health promotion field. And if I hadn't, it was actually based on the comment that this dean made in a course and the response I gave back to him that made him introduce me to these guys that made me go to the National Wellness Conference. And if any of those things hadn't happened, I might not be in this field.
It's amazing, these little next points. Yeah.
Yeah.
Fascinating.
Yeah.
Well, I forgot to ask if you had much connection with Don Kemper, because I interviewed him last week. And
I met Don and Molly probably 25 years ago, and have always been very impressed by their work and just the quality of human beings they are. So
yeah, aren't they something?
Yep, they really are.
And
up in Idaho, beautiful place.
Culture that they created in their organization. When I was there, I could sense it. Not only seeing dogs in the workplace, but that was something. The building itself was intriguing. But
I remember Don telling me about how he's planning this building, and I thought, wow, very cool.
Yeah. Oh, when I saw it, I was really impressed. Well, thanks again, Michael.
Yep.
This is great, and I'll let you know when the project's finished. We'll put it up on the web.
Wonderful. Okay. Thanks for connecting. Okay.
Bye.
Bye.